Turning now to our community focus, we are joined here on 12 News Now at 4 by the Director of the Department of Human Services, Courtney Hawkins. Director, thank you so much for taking the time.
Thanks for having me, Kim. Good to see you.
Good to see you as well. I understand that DHS conducted a series of surveys of child care facilities, which we know were temporarily closed down last year, have certainly been impacted by the pandemic. And these surveys asked these facilities about the financial toll that COVID-19 has taken on them. What were the findings of those surveys?
That's right. You know, our child care community has been tremendous during the pandemic. Right after a short closure when COVID-19 first hit, more than 85% of child care facilities reopened to serve families and have remained open all this time so that families can go to work and continue to try to keep themselves safe and earn money. And so we've been so grateful to the child care community. We've done a lot of work to understand what it's like to work during this time. And we heard three primary things. One, there were increased costs because of the COVID mitigations that we implemented to try to keep kids and families safe during this time. Two, they obviously had additional costs related to PPE procurement and additional cleaning. And then finally, you know, many of them experienced some kind of decreased enrollment. They were still open, but roughly, you know, only 75% of their kiddos had returned. And so they didn't have as much revenue coming into their centers or their homes to be able to sustain their business.
And so I know DHS is doing something to help them financially, this new grant program available to these facilities. What should folks know who want to apply?
Yeah, it's a grant program. We've tried to design it to be as easy to access as possible. If you go to kids.ri.gov, there's a page for the Children's Cabinet there that will link you to the application. And providers can apply for money. If you're a center, you can apply for $4,500 per classroom, up to $50,000. And our family child care providers are also eligible for a $1,500 payment. And we're hoping to make at least 2 payments to providers after they apply. We've had 30% of child care providers apply since Monday, which is great, but we'd like to see the full network of more than 800 providers take advantage of this opportunity.
I wanted to talk more broadly about the COVID-19 impacts on the programs that you administer. There are certainly a lot that fall under the DHS umbrella, programs like food and energy assistance, Medicaid. How big of a toll has the pandemic taken on those programs and the number of people who are seeking assistance?
We've seen most of the benefit programs have been pretty stable during this time because people most affected by COVID have most likely been taking advantage of the pandemic unemployment. But we know that the families that we serve through DHS programs have had increased need. And so our focus has been on how we can serve DHS customers and get increased aid to them over the past year. And the federal government has provided us with more than a dozen different changes to the way we administer our benefits to try to make it easier and to try to get more benefits out the door. So an example of that is in January, we implemented a 15% increase on the amount of SNAP families were receiving. Another program that we've now administered for more than a year is our pandemic EBT program, which provides families with money to make up for missed school meals. We also have not been terminating people who benefit from affordable health coverage from the state so that people who are on Medicaid don't have to worry about their health coverage. And I'll say, Kim, over the past few months, we have started to see the SNAP numbers climb a little bit. That's due to a change in the way the pandemic unemployment has been administered. And so I would say to families who are using pandemic unemployment with that extra payment, if they feel like they could benefit from SNAP, they would be eligible now, whereas previously they weren't, and they should contact the department about that program.
The Director of Rhode Island's Department of Human Services, Courtney Hawkins, thank you so much.
Thank you, Kim.